All right, well, good evening, everyone, and thank you for tuning into this webinar. I want to talk about a new procedure in the treatment of lumbar spine problems called Intracept. Okay, so the title of my talk tonight is an Intracept procedure for the relief of chronic low back pain. All right, well, unfortunately, as many of you know, and from the interest in the webinar, chronic low back pain is a common problem in the United States. For a definition, people are considered to have chronic low back pain if they've had pain for 6 months or longer. So if you look at the statistics, it's always kind of startling. 30 million US adults report chronic low back pain. That's more than 1 in every 10 people. If you look at the time in terms of just the cost for medical treatment, for loss of work, disability payments is the most expensive occupational disorder in the United States. A large number of people seek help for the problem that they have, and so 52 million physician visits are related to chronic low back pain. As many of us know who live in the state of Florida, opioids have been a problem with the problems people have had taking them. It's still the most commonly prescribed medicine for low back pain. And another kind of interesting figure that, or interesting statistic that I've always found interesting, if you will, is that it's the leading cause of disability worldwide. So the Bill and Melinda Gates Foundation did a study where they interpreted or they translated questionnaires in languages and gave them all over the world. So not only is chronic low back pain the leading cause of disability here in the United States and in other Western countries, as you might imagine, even if you go into societies in New Guinea and some of these places that are really subsistence societies, it's still, low back pain is still the leading cause of disability in every society that they looked at around the world. It's kind of an interesting finding. All right, so we'll talk about Intracept more here in a minute, but when you just look at the numbers, so if about 30 million people have chronic low back pain, there's certain findings that we're looking for on an MRI, these so-called Modic type 1 and type 2 changes. So about half of the people who have chronic low back pain will have these findings on an MRI. A fair number of people will get better with conservative treatment. So we always will try that first. And so of the patients, about 5.3 million, so about 1 in 6 patients who have chronic low back pain would potentially be a candidate for Intracept as a procedure if they don't get better with the other things that we can do. Now, as many of you know, there's this kind of carousel of different treatments for chronic low back pain. We often try some medications, physical therapy, chiropractic care, injections, or structured rehab. And all these have a role and can be helpful. But again, if you look at the numbers, roughly only about a fourth of people will get better with those things. So 3/4 of the people, or 75% of people, will still have pain at 2 years and will consider their chronic low back pain that the pain relief is not adequate. To talk a little more about the underlying science, it's something called vertebrogenic pain. So what that means, if you ask the question, well, why do people hurt? And you can see over here on the right of your screen, that's a micrograph of a degenerated disc. As the disc degenerates, there can be fissuring and fracture in the end plate, which are those holes that you see there on the top right. So we think that there is an inflammatory response. This leads to fractures, which then changes how the discs see stress or loading, which can lead to disc degeneration, and then ultimately the development of chronic low back pain. So it's part of the aging process in a sense, and unfortunately becomes more common as we get older. But it's certainly not it's normal to have some of the aging of the disc, but it's not normal to have chronic pain. But that seems to be the underlying mechanism. In terms of what we're actually looking for on an MRI, these so-called Modic changes, so you can see that circle there. And what you can see is you can see that inflammation or that white signal in the bone that's around the disc. We've known now for decades that when you study people who have Modic changes, if you get MRIs with people with back pain, we know that the people with these findings have the highest amount of pain compared to the population with chronic low back pain. We know that they have more frequent episodes or more commonly have flare-ups of their back pain. We know that in generally people with Modic changes that they have the worst outcomes with our conservative treatment options. And so we've known that about these Modic changes, but other than just having a diagnostic component to it, now it can actually help guide treatment. And that's the exciting thing about this new procedure. So what, and thinking a little bit more about the anatomy, what we think actually is the main nerve that transmits pain signals. So like, why do you hurt? You know, what nerve is actually irritated? I think it's this nerve called the basivertebral nerve. It's kind of shown here, again, on your right side. You can see the nerve endings actually go to the end plates. And so a lot of work has suggested and shown that this nerve is what transmits the pain associated with this inflammation of the end plates. So the Intracept procedure itself, which is to the treatment of chronic low back pain associated with Modic end plate changes. So what it is, and it's shown again here in schematic form, is a minimally invasive procedure. The target is the nerve itself that transmits pain. So through a radiofrequency ablation procedure, that nerve is deadened so it no longer transmits pain. It's an outpatient surgery. Other things that come up is there's no implants, and so there's no, I know many people I talk to have concerns about having a lumbar fusion, which has been the gold standard of treatment now for a long time. But with this procedure, there's just a catheter, a radiofrequency probe. There's no implants. You could always go back at some point and do a fusion if that were really necessary. So all the future treatment options are still on the table. But the neat thing about this procedure is it really seems to work, and we'll go through some of that evidence. This is all that's involved. If that's helpful for people to see, at the bottom there's a large needle or trocar that's introduced into the vertebral body. There's a cannula that's used to basically create the right channel. And then on the top, that blue probe is placed in, it's turned on for 15 minutes, and then that is the ablation procedure for the nerve. To go through a little schematically here, what's actually being done, starting from kind of 1 to 4, that needle is used to access the vertebral body. There's a channel that's created. There's a probe that's placed. That probe is used to ablate the nerve, and then the cannula is removed, and it's literally a Band-Aid over the small hole made by the needle. In terms of who is actually a candidate for this type of procedure, it's someone who now has had chronic low back pain for at least 6 months, that people have not responded to conservative care, which it needs to involve at least physical therapy, maybe some other injections, some medications like anti-inflammatory medicine, and then have these findings on the MRI, what are called Modic changes. And you can see those, but it's basically inflammation in the bone around the disc. And that's really how this was studied and how it's used. So if people don't have those findings, in no ways does that say you, of course, don't hurt. It's just that unfortunately this procedure is not indicated and won't really help. It's less likely to help you. So I just wanted to run through this little video here. I think it's helpful again to kind of understand what is causing the pain and what's actually being
Research
done.
over the past 20 years has concluded that the vertebral end plates are a significant source of chronic low back pain.
So that shows the basivertebral nerve.
The vertebral end plates have been shown to be more innervated than intervertebral discs, with the basivertebral nerve transmitting pain from the superior and inferior end plates, and basivertebral nerve endings proliferating in vertebrae with Modic changes. Modic changes strongly correlate with chronic low back pain and with higher levels of pain and disability. Collectively, these findings validate vertebral end plates as a significant source of chronic low back pain in patients with type 1 or type 2 Modic changes, and indicate that some patients diagnosed with disc pain actually suffer from vertebrogenic pain transmitted through the basivertebral nerve. The Intracept procedure was developed to target the basivertebral nerve for the treatment of chronic vertebrogenic low back pain. Using a transpedicular approach, the introducer is advanced under fluoroscopic guidance. The curved cannula is utilized to create a channel to the trunk of the basivertebral nerve. The probe is inserted into the curved path, placed at the trunk of the basivertebral nerve. Bipolar energy ablates the basivertebral nerve to stop it from transmitting pain signals. The Intracept procedure is supported by 2 Level 1 randomized controlled trials. The Level 1 Intracept study demonstrated significantly better improvements in pain and function for those treated by basivertebral nerve ablation compared to standard medical care. The SMART trial demonstrated statistically significant and durable relief of pain and improved function through 5-year follow-up. Similar improvements in pain and function were demonstrated in a subsequent case series from 2 large community-based clinics. The Intracept procedure is a proven, durable treatment for the relief of chronic vertebrogenic low back pain.
I think we're done. Okay, so I know there's a lot of information contained there, and I want to go through some of the clinical evidence a little more slowly. So, what is really the evidence that this procedure works? And so there were 2 major studies I'm going to talk about. So one was the procedure Relievant compared to actually a sham trial, which is often not done in surgeries. But when it was compared to, people would go to sleep, they get a needle put in their back, but then nothing else was done. That was the sham compared to Relievant. And, what is seen there is that, so the procedure works better than the sham. Now, some of these slides here, so what the ODI is it's called Oswestry Disability Index. So basically, the higher the score, the more pain you have. And you can see to the slide to the right, where the people who were treated, their ODI went on average from 42 to 18. So just to provide some context, people who have an ODI of 40 have significant disability. They have pain with everyday activities of daily living. There's lots of things they can't do because of the pain. And then when you get down to 18, so if you look at the general population who has no back pain, they would have an ODI of about 10 because, essentially that's the way it's scored. So they get pretty close from significant disability to pretty close to normal in this first study that was done. There was a second study where they compared the procedure to the standard of care. So the standard of care being physical therapy, epidural steroid injections, non-steroidals, all the things we talked about earlier. And it was done at multiple sites around the United States, 20 different sites. People were then followed afterwards at 3, 6, 9, and 12 months. And what it was seen was, again, a statistically significant improvement in pain and function with the Intracept procedure compared to the normal standard of care that was present before this procedure was available. Now, again, here, so the ODI, we talked a little bit about it's It's the Oswestry Disability Index. So the change there, that there is a 25-point improvement in the amount of disability that people had who had the Intracept procedure compared to only a 4-point improvement in their reported amount of disability with standard care for chronic low back pain. Now, the VAS score is a different way. That's that question where if you ask people, so if you were to rate your pain on a scale of 1 to 10, with 10 being the worst, how much pain do you have? So people often will have procedures will have 6 or 7 or more. And so the change there, that amount of pain went down by almost 3.5 points with the Intracept procedure versus just a point with a standard of care, which is, again, sending people back to therapy, trying injections and those things. And there's been some other interesting findings that have come out of this. So you say, okay, well, that's great. You know, I'm better at 12 months, but how long does that last for? And the exciting thing about this study is they followed people out to 5 years, and the pain relief that they saw at a year continued for 5 years. So really, any medical treatment that is going to work for 5 years, we consider successful. So the decrease in disability lasted for 5 years. The amount of improvement that people saw and the VAS score, this visual analog score, lasted out to 5 years. You know, there's a lot of percentages on this slide, but at least 2/3 of people thought they were more than 50% better, and 1/3 thought they were completely pain-free. There's other ways to look at how much pain people have. If you look at the amount of reduction in opioid use among patients with chronic low back pain who had Intracept procedure, it was almost 75% at 5 years. The number of additional injections that people had because they were having the flare-ups of their pain was down over 90%. So again, less opioids after the procedure compared to the people who do not have it, and fewer use of additional spinal injections. And again, it lasted out to 5 years. So if you ask people 5 years later, well, did you know that 7 out of 10 people thought that their condition had improved. 50% thought it was dramatically better. Another question I always find to be interesting and useful in these studies is almost 80% of people, or 8 out of 10 people who had this procedure, said that they would have it again. And 65%, more than half, said they went back. They're back to the activities that they could do prior to developing chronic low back pain. All right, so again, when you're thinking about having a procedure done in medicine, we talk a lot about how good the evidence is. So when there are randomized controlled trials where people are randomly assigned to have either the treatment or sham procedure or the usual care, it's what we call level 1 evidence. Now, I know the whole design of medical trials sometimes can be a little boring, but level 1, what it really means is it's considered the best evidence that we have for any medical procedure. So as it goes from level 1 to level 6, level 6 is just really expert opinion, but it's the best evidence that we can generate in medical science that something works is what level 1 evidence means. Again, 2/3 of people had more than 50% improvement, and 1/3 had no pain at 5 years. And people used fewer injections and fewer opioids, and really there was almost no serious devices. Because the other thing that would always come up as well, you know, are there complications? And it was less than 1%, and that resolved. Certainly, if you compare it to the world of spine fusion surgery, there are much more significant potential complications. Now, you know, if we talk about if anyone comes in and ultimately is interested in having this procedure, you often hear from your insurance company, they'll say, oh, well, it's experimental. That's not really true. It's not experimental. The studies have been done. It's just a phrase that they give basically everybody when they want to deny a procedure. So I think it's misleading on the part of the insurance companies to say it's experimental. It's just what they're saying is they simply don't want to pay for it. So if people come in and are candidates for it and are interested in having this, there's a process that's involved. The company itself runs a dedicated patient access team. Really what that means is that they'll take patients through kind of every step of the process to try to get approval from your insurance company. Generally, about 7 out of 10 people will get insurance approval, but it can take a while because there's a process. Sometimes there's denials, there's appeals. It currently takes almost 3 months to get insurance approval for this procedure. That's not true for all insurances. That's just an average. But the company will walk you through that and assist us with getting that approval. And then one other thing I just wanted to, again, I know that all the science can be kind of dry, but there have been patients describing their experience with it, and this is one short video of that description that I thought was quite moving. Listening to Allison talk about how the procedure helped her.
I was a decades-long low back pain sufferer, and there'd be times when it would get worse. There'd be times where it would get better, but I was never pain-free. I found that I couldn't do some of the basic things I like to do, work out with ease, go for long walks with ease. Going to the movies was out because sitting there in one position for 2.5 hours was impossible. Towards the end, it actually got very difficult for me to get up out of bed. So can you imagine you wake up in the morning and you dread it because the idea of stepping out of bed is just going to cause pain. The real shame of it for me was we had a grandbaby. I couldn't hold him for long without having pain in my low back. And then when he started to be able to crawl and want to play on the ground, he'd always kind of hit the ground wanting me to sit on the floor with him. Well, if you've ever had low back pain, sitting on a hard surface is just kind of send shivers through you. It's so painful, and I just couldn't do it. I did get steroid shots. I did have, physical therapy, the heavy dosages of muscle relaxants. Some of them gave me some temporary relief, but it was always temporary. I had been seeing a really terrific orthopedic surgeon, and he had recently become involved with the Intracept procedure, and he started to tell me about it. This procedure just sounded like, oh my gosh, is that really possible? How is it that with this non-invasive technique, you can, eliminate your back pain? So I, like you do with any surgery, shut my eyes and then came back and woke up. And my doctor came in and he told me what a great success I was, that everything seemed to work. By the next day, I was up, walking around, and I was like, oh my God, it must still be the anesthesia because I can't feel the pain anymore. And I'd convinced myself that the pain was going to come back, but just to a lesser degree. Another day went by, and I'm like, okay, the anesthesia's gone by now. I don't have that pain. This is like crazy. I did have a little bit of soreness, just the puffiness from surgery, but I was bending. I was getting up out of bed with no problem. I was walking around the house with no problem, and I was still in awe that this can't be. Like, when is the other shoe going to drop? When's the pain going to come back? And I think it wasn't until I was about 3 or 4 weeks out, because then I knew everything related to the surgery and the medicine was gone, that I was truly, I can't even put into words how I felt, because my life changed. Since the procedure has happened, I've really been able to experience life as I've always felt like I should. Completely free to move, to run, to get up, to exercise, to run around with Gabriel, to lift him, to go on travel. My husband and I have been taking trips we weren't able to take before. And I never give my low back a second thought now. And it's just, I'm reminded of how bad it was before, because I literally went from decades of pain to being, for me, completely pain-free.
again, very touching story. So just to summarize, so when you look at the Intracept procedure, I think there's a strong scientific foundation. It's a straightforward procedure. There's really good evidence that it works. And the other great thing about it is for the people it works for, there's durable pain relief, so out to 5 years. And although there can be issues with getting insurance approval for this procedure, there's a process, there's a team that can help every step along the way. Certainly dealing with insurance companies can be confusing and problematic. So that's another nice piece of this. So anyways, if people have questions, of course, I'm happy to answer them. Another website that I didn't put on here, if you just go to Intracept, so the name of the procedure, intracept.com, it has a lot of the same information, testimonials, and explanation of what the procedure is. Typically not. There's different types of scoliosis. So there's a type of scoliosis that people will, that patients, that adolescents have, which is not what this procedure is designed for. However, adults and especially people over age 40 can develop something called degenerative lumbar scoliosis. And so what that means is a scoliosis develops as part of the aging of the spine. Those patients, if they have these modic end plate changes as part of the degeneration that leads to the scoliosis, then yes, they would be a candidate for Intracept procedure. A patient of mine I just recently treated with Intracept did have some underlying degenerative scoliosis. And, you know, in the days before the Intracept procedure, really the only way to treat that would have been a 4-level lumbar fusion, which is a much more involved surgery with anywhere from 6 months to a year recovery time. And this particular patient was able to go back to playing tennis at just a week after the procedure, which, so generally it's not a treatment for scoliosis, but in a subset of patients with degenerative scoliosis. Essentially, no. There can be some patients don't really have any pain. Other people will hurt for about a week afterwards because there's some bleeding associated with it from that use of the radiofrequency probe. So I tell people to be a little careful for the first week or two, but after 2 weeks, people have no restrictions. And if they feel fine, I'll let them go back to activity sooner. As many of you know, it's a newer procedure that we're talking about. So I have done 3. As it turns out, I was the first person in Northeast Florida to do one. So there have been 1 or 2 done at the Mayo since I've done the first one. But it is a newer procedure, but it builds on a procedure that many of us have had decades of experience with. So the procedure that's similar is something called a kyphoplasty, which is where basically some cement is placed in the vertebral body for patients with fractures. So that type of, it's a different type of cannula system, but it's very similar. So it's helpful to do in the hospital under general anesthesia. And so typically patients are able to go home. So far, everyone I've done, I've sent home, but because I do it in the hospital, if someone had too much pain to go home, we could keep them overnight and treat their pain and make sure they mobilize well with physical therapy before they go home. If you have if there are those modic end plate changes and you have chronic back pain, then the answer would be yes. There's no, unlike some perhaps other treatments, there's no contraindication to osteoporosis. So there's no, it does not seem to make the bone any more likely to fracture or something like that. So the typical OR time, it does take a little while because when that probe is put in, it takes at each level that's done, the probe has to heat for 15 minutes. So several levels are done. An hour and a half would be the typical OR time. There really, thankfully, have not been many described complications. The probe is insulated. There have been a couple people who have had some leg pain afterwards, maybe because the energy from the probe irritated the sciatic nerve that goes down your leg. Those people have gotten, I've not seen that, but the couple of people that has been reported on got better within the first week afterwards. I suppose anytime you have a procedure done, you do worry about the risk of infection, but that has not been seen with this so far. At some point, someone will have an infection.
Is there any difference in an orthopedic surgeon doing this procedure as there is a neurosurgeon?
So in terms of people who do these procedures, there's spine surgeons, which would be both orthopedic and neurosurgeons. There are some pain management doctors do them as well. I think anybody who has experience with the use of cannulas and things around the spine would be able to do a good job.